Hello and welcome to this COVID data for Ireland analysis tool based on the open source pivottable.js project and with data provided by the Government of Ireland and the HSE and Ordnance Survey. It's provided in a linked data format that I've converted to make suitable for the pivot table and fixed a few inconsistencies in the data. So what have we got on screen here? We can choose the data set. Got data about the death rates. Hospital data tells us about healthcare worker cases, hospitalized cases, ICU required cases, and the overall COVID cases confirmed. We can break it down according to the classification of the case, where it came from, by gender, ages and counties. Let's show you how this tool works. So we can drag these bricks from this tray of options into one of these two areas. So I can look at the month brick, and if I use my aggregator here, I can say I want to look at the sum of COVID cases confirmed broken down by months, and we can see we have our list of months and we can see the numbers there. We don't have to look at it just as a table. We can look at it as a heat map and have it a bit colored. We could look at it as a bar chart. There are our months. We can drag this month brick up to the top and get the months labeled in our bar chart. Instead of breaking it down by month, we could break it down into weeks, and you see the shape of the curve, the initial wave, and then this sort of second wave that we're starting to go through. If we want it more finely grained than weekly, we can drag the date brick in, which will do a day-by-day analysis, and we can see that curved shape and the second wave. Don't have to do a bar chart though. We could do a line chart or an area chart which colors it in and will look more like a stacked bar chart. This is looking at the total number of COVID cases confirmed. We could look at the impact on healthcare workers and see a different shape to that graph over time. We could look at when the ICU was required. We could use a different aggregator. We could use an aggregator saying we want to look at one sum over another sum. And we could look at the number of ICU required cases out of the hospitalized cases. Maybe looking at it on a monthly basis. So we can see as a percentage, between 10 and 20% of hospitalized cases ended up in the ICU back in the peak of the outbreak in March and April. Whereas in later months, so in June, a good 70% of the people who were hospitalized ended up in the ICU part of the hospital. If we look at the sum of ICU required out of COVID cases confirmed, the graph changes again a bit. We can see that back in March, between 1 and 4% of all COVID cases confirmed ended up in the ICU. In June, that was a higher percentage, but of a smaller number. Let's look at a different breakdown. If we look at it by gender. So it's tried to keep the options we chose on the previous data set as best it can, but some will be blank. If we just look at the sum of cases, and instead of looking monthly, we'll look weekly, and then we'll pick up this gender option and drag it down here, and that will split out the blue is the female cases, male is orange on this one, and green is unknown. Instead of an area chart, which stacks one on top of the other, we could look at a line chart to see them side by side. So that this is showing that the initial outbreak affected more female patients, or more female cases. They were not necessarily hospital patients, compared to the impact on male cases. If we look at the second wave, however, we can see that that's predominantly male, possibly due to the demographics of where the outbreak is. And this one, I suspect, is probably due to the demographics of the older age group. If we switch, instead of looking at gender, we look at ages. So again, we've got this shape of the initial wave and the second wave. Let's look at it day by day. And we want the age brick, and we'll break it down by age, and we see the different age ranges as different coloured lines. If we look at this one as an area chart, you can see the initial peak. Let's look at it weekly. It makes more sense that way. The weekly smooths it a bit more. So you can see the number of cases. These are sort of decades of age. You've got the children, teenagers. So the red one is the first one that's a full decade of age, and then you've got 25 to 34, 35 to 44, 45 to 54, 55 to 64, and then the last one isn't a decade, that's 64 plus, so that's 64 up to 100 and something, whatever you think the top end of age is. We can click on the little down arrow next to any of these bricks and select which we're going to include. So if I say I don't want to include children, I can untick those and apply that, and the graph will update to show those above children's age. If we want to look at the age demographics of this second wave, I can select with the mouse and zoom in on this, and you can see here that the older group, the 64 plus group, is actually quite a small percentage of this second wave, and this represents an outbreak in a working age community, which we know it's the meat packing industry that's where the bulk of the second wave cases have emerged from. Moving on from ages, let's look at geography and look at the counties. So this is looking at 26 counties, and if we break it down by date and by county, again we're looking at the sum of cases here. So an area chart's probably not the one we want. If we look at let's say a tree map. So a tree map, we can see that up here it's Dublin is a good proportion of all cases. Now with the tree map, it only really looks at one of the axes, but we can still filter, and we can look at, if we filter on the months and we say we're only interested in August, we can see that Dublin is not really where it's happening, this second wave. It's in Kildare, Offaly and Laois. And those are the three counties that have been locked down. So even though Dublin has still got some cases going on, it's not an intense outbreak there. It's just Dublin is where a lot of people live. If we stop filtering on Dublin and say go back to, let's go to a stacked bar chart and break it down by month. So you can see Dublin was a huge part of the outbreak, but we can look at not Dublin. So this is the shape of the outbreak across 25 counties, so excluding Dublin. And you can see how evenly it was shared between the various counties. In fact, if we look at, let's see, I forgot which counties it was then, Offaly, Kildare, Laois. So if we look at these counties, we can see that the August outbreak compared to their experience of the first wave, and you see that it is, yes, pretty much like May was. And if we look at that broken down into weeks, we can see that last week was right up there compared to some of the weeks back in April. If you're dragging these around, you probably don't want to drag the months and weeks together, because that will, because weeks don't break across month boundaries nicely. So for example, down here we've got week 14 in April and week 14 in March as two different buckets on this bar chart. So it should be obvious. You'll have like 2 days in one and 5 days in the other. If we look at deaths and cases, that's our other data set. Again, sum of cases, we've got our 2-peak wave, and we can change what we're summing, whether it's the deaths or the cases, and you can see here, as I switch between those, the shape of the graph and the position of the mean will move on a few weeks from the cases being reported to the deaths happening. And you could break that down into individual dates, and you could change this from a bar chart to a TSV export, and this will give you tab separated values that should be suitable for pasting into a spreadsheet, which might be allow you to look at the mean and standard deviation of the of those times and see if you can estimate an average distance between diagnosis and potential deaths from COVID. Looking back at the hospital data, and again onto bar charts, and if we look at the sum of COVID cases confirmed, so here's our normal shape. In this and in some others, we have cumulative metrics. So we can look at the cumulative COVID cases confirmed, and we see this shape, which is a sigmoid shape, which is the integral of a bell-shaped curve. So we see the outbreak increasing exponentially, then we locked down, and it leveled off, and now it's creeping up again. You can also look at the final metric on this one is the clusters notified. This, I think, is probably not very useful statistically. I think it mostly shows that the authorities are now identifying and classifying clusters better than they used to, rather than more clusters actually happening. When you've got a big outbreak, you don't have individual clusters, you have it just happening everywhere, which is back in April in Dublin. That's pretty much what was happening. It was popping up all over the place. But we can see, well, you got sums of we got 35, 24, sort of 20 to 30 clusters being notified daily around that time, and then June the 29th, apparently 258 clusters were noticed. There were a few gaps in the data. June the 30th is just completely missing from the Irish data, and if you go to the raw data sources, which is the daily report from the public health emergency team, and that's missing on I think it's July the 2nd, which is when they should have reported the June 30th data. That was a very simplified report with no numbers in it. So I tried to plug those gaps in the data, and there was one day where they got the male and female ones the wrong way round. Very obvious what mistake they'd made, so I fixed it in the data. And I think that about wraps things up from what I can show you from this quick overview, but do have fun with it, drag things around, draw your own conclusions, and let me know what you find.